All right, good morning. My name is Mary Leonard. I'm chair of the Department of Pediatrics, and it is my great pleasure to welcome you to this morning's Grand Rounds, a really special Grand Rounds, as you will hear, but I also want to call your attention to upcoming Grand Rounds. So next week, we are so fortunate that the divisions of endocrinology and adolescent medicine are hosting Catherine Gordon from NICHD. Catherine's a very distinguished scholar and double boarded in adolescent medicine and endocrine, and now it really is a national thought leader, and going to be speaking with us about models of estrogen deficiency in adolescents. So we're very excited for that event. Lots of planning. Lots of people we know will be interested in meeting with Catherine and hearing her presentation. And in the following week, we have a really special one of our endowed lectureships from the family of Jonathan Zhu, who was a patient who we cared for here with many years with Cockayne syndrome and kidney disease. And when he passed, his family set up funds to support a speaker on education and compassionate care. And so we're going to be hearing from Rachel Callender about Words Matter, the impact of language in healthcare. So another really special event for everyone to look forward to. And then we have our usual housekeeping. Just give everybody a second here to make note of the text code and what you need to do to get your MOC CME credit. So thank you to the team for taking care of that. And then our land acknowledgement that we recognize that Stanford sits on the ancestral land of the Mweka-Ohlone tribe. This land was and continues to be of great importance to Ohlone people. Consistent with our values of community and inclusion, we have a responsibility to acknowledge, honor, and make visible the university's relationship to Native peoples. And then it's coming up to start thinking about our pediatrics research retreat on April 25th. This is always a really exciting event, especially because it's such a great chance to meet some of our new faculty, hear some of them are really our more experienced faculty, but especially our trainees, our residents, our fellows, our postdocs. So it's time to start thinking about the abstract deadline, which is coming up on the 22nd, the 22nd. And then we're also calling for mentors for the PIPS program. I hope everyone is aware about the pediatric internship program at Stanford. It's a very, very unique program in the School of Medicine. Really nothing else like it, bringing in URM, low-income, first-generation high school students for a wonderful structured mentored research experience. So we're always looking for mentees. I think we're on the order now. I'm having about 40 students that spend the summer with us. It's a really joyous event, and what makes it very special, I think, is not just the program for the high schoolers, but all the work that Allison Guerin and the whole team do to support the families and the parents, things like college applications and financial aid. So it's a really innovative program, and what makes it so exciting when everyone comes together is just the variety of folks who are who are serving as mentors for these really quite extraordinary high school students. So please consider being a mentor to one of our PIP students. And with that, I'm going to then come back to today's Grand Rounds, and I'm going to introduce Dean Winslow. He's got quite an extraordinary biography. It's hard to do this very concisely, but I will say we're so proud that as somebody trained in pediatric and adult ID, he has, through all, as you hear about all the work he's doing throughout it all, he has been seeing patients on Welch Road in the Peds ID clinic a couple days a month. So he is a professor of medicine and pediatrics and a senior fellow at the Freeman Spogli Institute. He was in private practice in Delaware when he started the state's first multidisciplinary clinic for HIV patients in 1985. Over the ensuing years, very distinguished work as a bench scientist on HIV drug resistance, work that led to the FDA clearance of the HIV drug resistance test. He then joined the staff at Santa Clara Valley Medical Center in 2003, where he served as chief of the Division of AIDS Medicine and later as chair of the Department of Medicine. And then in 2015 was appointed vice chair of the Department of Medicine at Stanford and academic physician-in-chief at Stanford Valley Care. And we were reminiscing a little bit about some of the work he did with Alan Schroeder. So again, one of our own. He was lead physician for the U.S. Antarctic program of the National Science Foundation, based at McMurdo Station in Antarctica. So he entered the Air National Guard in 1980, was a distinguished graduate of the UASAF School of Aerospace Medicine. He was deployed to the Middle East many times after 9/11 as a flight surgeon supporting combat operations in Iraq and Afghanistan. He has extensive operational experience in fighter, tactical airlift, and combat rescue missions. In 2017 was nominated by the president to serve as Assistant Secretary of Defense for Health Affairs. For many years, he arranged medical care in the U.S. for Iraqi children who had complicated medical conditions for which care was not available in Iraq. And with his wife, Julie Parsonet, another faculty who we are very proud does really wonderful research on maternal health. They created the Eagle Fund of the Silicon Valley Community Foundation, which provides aid to Middle Eastern and Central American refugees. We also, through our advocacy work, Lisa Chamberlain and Dan Bernstein and others are really passionate around issues around gun regulations. And in 2018, Dean co-founded Scrubs Addressing the Firearms Epidemic, SAFE, which unites healthcare professionals to address gun violence in the US as a public policy issue and to advocate for education, research, and evidence-based policy to reduce gun violence. But turning to the topic today, in 2021, he took leave from Stanford to lead the US COVID-19 Testing and Diagnostic Working Group, and he served as the CDC Senior Advisor to Operation Allies Welcome and Chief Medical Officer for the Southwest Border Migrant Health Task Force before coming back to Stanford last summer. And when he came back, we were really eager to have him come to Grand Rounds and talk to us about directing the COVID-19 testing and caring for Afghan refugees and children at the Southwest border. Welcome, Dean. Thank you.
Thanks so much, Dr. Leonard, for inviting me. Also, I'd like to just quick shout out to Justin and Ingrid for all their help, getting me set up this morning. So anyway, I thought, talk about, again, what you covered today. And, again, COVID is a little bit in the rearview mirror, I think. But again, if you look at wastewater levels, there's still a lot of it out there. So anyway, we'll talk a little bit about kind of what it was like trying to, run the testing and diagnostic working group for the U.S. government sort of during the height of COVID, some of the challenges we faced and some of our successes and maybe some places where we fell short. And then also, time permitting, talk a little bit about the challenges with the resettlement of Afghan refugees that all arrived in this bolus during the fall of 2021, and then also the ongoing issue of care for particularly unaccompanied children at the Southwest border. So anyway, with that, again, no conflict of interest to declare. And this is, again, kind of what we're going to talk a little bit about in the first part of this talk. It was really an amazing opportunity, which I largely have to thank one of Dr. Parsonet's former EIS colleagues, Dr. Ann Schuckett, who was for years the principal deputy director of the CDC, who asked me to relocate to Washington, D.C. for that year and a half to help run the COVID-19 testing group. But again, I had a budget actually at one point of $46 billion. And I'm not really that good at math, so I don't even know how many zeros that is in that number. And I had 82 people that reported to me as part of the group, and they came from about 30 or so from the CDC. I had roughly a dozen from the FDA, from FEMA, from ASPR, a large group of people from the Department of Defense, which were actually the people that were primarily tasked with the actual procurement. And so again, this group was originally set up during the late summer of that last year of the Trump administration. And it was really kind of in a way part of Operation Warp Speed, which I'm sure many of you have heard of. And so when I actually arrived in March of 21, General Perna was still there. His office was down the hall from mine. And of course, that was a huge success in terms of the rapid rollout and procurement of the messenger RNA COVID-19 vaccines. So anyway, this was the building that I worked out of in DC. This is the Humphrey HHS building. And it was just a few weeks after I started work there. My son, who was an NYU graduate, he took the train down to visit his dad. And so I was showing him around, and my son's very sophisticated. He took one look at the building and he said, "Dad, do you realize that's a classic example of brutalist architecture?" And I'd never heard that term before, but now it's one of my favorite terms. But the building actually was directly across from the US Capitol. So honestly, this was a picture I just took out the window of my office. So when I'd have a kind of a bad day or a stressful day, and rather than quitting, I'd look out the window and say, "Hang in there, Dean. You're hopefully doing some good stuff for our country." So when I arrived, again in the very early spring of 2021. Remember, I think at that point, there were already more than 1 million Americans that had died of COVID-19. And so again, this is a photograph I took on the Mall. probably in early April of that year. And again, people had actually placed these little white flags corresponding to each American that had died of COVID-19. So again, that was kind of a reminder of just the importance of the work, that we and others within the federal government were doing to try to reduce the impact of the epidemic. So again, this is just a file photograph. So I think also remember January 6, 2021, that also happened really just a few weeks before I arrived there. And honestly, Washington, D.C. was still very much on edge. At that time, more than 4,500 National Guard troops from all over the United States were on active duty in Washington, D.C., actually providing security for every single federal building. So again, it was a kind of a weird time really in our nation's history. The other thing, just backing up a little bit, so since the CDC and all federal agencies, is quite a process to go through to hire someone as a civil service employee, that the California National Guard actually, even though I retired from the Guard and the Air Force back in 2015, they actually brought me back on active duty to basically kind of take command of this group. And so they actually paid me until CDC finally brought me on board as a civil servant. So it was kind of joking. It was kind of funny to be after not having worn a combat uniform since I got back from Afghanistan in 2011. I'd given mine away. So I had to drive up to Travis Air Force Base to buy a new OCP uniform, but I kind of blended in. And so I made friends with, of course, the different guardsmen that were guarding our building. And that's a picture that they took with me. Just a little bit of the history of the Guard for folks that are kind of interested in it. So my first Guard unit that I was a member of was when I was doing my training fellowship in New Orleans, and it was the Louisiana Air National Guard. And of course, all of the states, had militia units, and of course, those that went with the Confederacy served with the Confederacy during that time. So I wasn't particularly proud of that, but it was a huge amount of fun being part of one of the finest fighter squadrons really in the United States. And so I got to fly a lot. The lower scene on the bottom is my buddy Jim Eggplant, because his call sign Kegel. And that is, no kidding, a piano that's actually been set on fire that he is playing. So that's kind of what parties were like at our drill weekends. And then the other unit I belonged to, my last 20 years of the career, was the Delaware National Guard. The Delaware Guard was actually created, I think, like in 1636 or something like that. So it predated our country by like 150 years almost. And the scene on the right is the Delaware militia giving the British hell at the Battle of Long Island in 1778 or whatever that was. And then lower left is flying a combat mission in Afghanistan in 2011. And then, of course, now I'm the third Guard unit. I'm with the California Guard, so I did a little research about the history, and they actually had a very proud history. And again, they were, I think, something like 50,000 volunteers from California served with various Union Army units during the American Civil War. So again, I made sure to visit the Lincoln Memorial when I was there. So again, switching to really what the main talk is about the Testing and Diagnostic Working Group, we had a broad mandate, to understand diagnostic supply chains, issues, contract and actually procure not only, completed diagnostic kits, also, though, work really closely with regulatory agencies to help facilitate and, if possible, even fund companies that were trying to get their very much needed diagnostic tests through the FDA EUA process. There was also, again, I think you remember back then, really serious supply chain issues, things like microchips, cotton swabs, all kinds of reagents were in very short supply. And so as best as possible, we work primarily with, of course, companies in the US and also outside of the US, but particularly in Western Europe, our allies, to actually procure some of these needed things and actually build up what's called the SNS, or the Strategic National Stockpile. So I'll talk in a little bit more detail as we go through there about some of the other things that are listed on this slide. Again, this is just kind of a summary. So understand supply and demand, manage the U.S. government efforts to expand testing capacity. And again, a lot of procurement. And that was, again, the big thing that DOD did for us. And then the third thing, of course, would be provide rapid response. And then, of course, conduct analysis and develop policy with our other partners, particularly at CDC. So again, industry engagement, I had a full-time person actually on loan from the FDA named Steve Santos, who actually talked to the major diagnostic manufacturers just about every single day to kind of keep them in the loop, give them a heads up about, particularly when new procurement requests would be coming through. We also work very, very closely with our not only federal partners within HHS, but also state health departments, territorial health departments, Bureau of Indian Affairs, and as well as even down at the county health department level. And again, I'll go through a little bit more detail with that. And then I think as you also remember that the particularly surge of unaccompanied children dramatically increased in 2020 and into 2021. And so again, this population was almost completely unvaccinated for COVID-19. So this was a real issue. And we, I think, responded to it in a way, and I'll go through that toward the end of the talk in more detail. And then also one of the things that, since we had such a big budget, that I also wanted to support, some of the basic science. And so we also worked with other HHS agencies to actually establish a serum bank of repository of specimens in Bethesda. So again, procuring tests and supplies. This was real important stuff, and I'll go through again in more detail some of the specific programs. The two main operational programs that my group was responsible for was what we call the ICAT program, which stood for Increased Community Access to Testing. And then our school-based testing program was Operation ET, or Expanded Testing. And then we also collaborated with the CDC ELC on other efforts to help provide testing in schools. And then again, industrial-based expansion was always something that we kept in mind. So one of the things that I really loved about this job at CDC and running the TDWG was just the amazing, really wealth of data that I received. So literally every other day, I would get, of course, computerized, printout essentially of very detailed data analysis of case rates, vaccination status, all correlated with what's called social vulnerability index. And I'll show you an example of this type of data in just a few minutes. But literally every other day, I would receive, again, a breakdown of case rates and vaccination status by every single state, and really down to even the county and city level in many cases. This was so helpful in terms of where do we put our main priorities for rolling out tests. And then again, this is an example of the data that I would see again for really almost again all of those areas. So again, social vulnerability index was something I wasn't real familiar with, but it's a very precise term that actually looks at communities, and they correlate things like income level, education level, housing insecurity, food insecurity, and things like that. And that all goes into what is called the SVI rank. So again, as much as possible, we tried to prioritize our free testing efforts in communities with a high SVI. So again, the ICAT program was a big program, and I had probably at least, I would say 20 of my 40 or so CDC people were involved with ICAT at one role or another. And so ICAT had four major components. had pharmacy partnerships. So this was probably the largest group in terms of, the amount of money that we spent. So we had relationships and actually contracts with Walgreens, CVS, and a company called Eat True North, which is actually a major pharmacy chain in the Midwest. We supported surge site testing in collaboration with state and local governments. And often, we would actually, set up shop, let's say, in a Costco or a Walmart parking lot with state agencies, with tents set up, and again, offer free testing as well as free vaccination, again, in areas of either hotspots or preferentially in areas with high SVI. We also did pop-up testing events, and I'll tell you kind of a funny story about that in just a minute. And then ICAT also included a fairly sizable school testing program. And this used both point of care tests as well as, again, swab and send PCR tests as well, kind of like we were doing at Stanford back during the height of the pandemic as well. So again, one of the first pop-up events that our group was asked to support was in the late spring of 2021. And NASCAR, which is, of course, this huge enterprise, really wanted to open up NASCAR racing again. So again, our group was approached, I think, by Alabama Public Health Department and said, hey, is there any chance that ICAT, could help support free testing at Talladega? It's going to be like the first NASCAR race that they'd had for 2 years. So anyway, a number of my group, of course, were in Atlanta. That's where they lived, and they were, temporary duty and, away from their families, coming up to Washington, D.C. 3 out of 4 weeks a month. And so a number of them actually said, well, gosh, if I volunteered to go support Talladega, would you let me stay an extra weekend in Atlanta? And I said, sure, but I put the caveat on that I wouldn't sign off their expense report unless they did some education ahead of time to be prepared for Talladega. So I told them that they had to watch this movie, Talladega Nights with Will Ferrell. It's actually a hilarious movie. It's kind of cringy though in some ways, but so everybody swore that they did that. Okay. Let's see. So again, other aspects of ICAT that we talked about, again, we did want to really support largely underserved school districts. And so we actually were able to expand this eventually to more than 20 states and literally hundreds of school districts. I think we did make an impact there, to try to get schools reopened. One of the things that I was concerned about, these data were not available back then. This actually was just published a few months ago. But what this showed, and I think many of you, who are parents, and of course, all of your pediatricians realize, is that students really suffered during the COVID-19 pandemic, all the way from preschool up to university students. I think really suffered from both educationally as well as from the social isolation and all that. In fact, again, being a father and a grandfather, I certainly was very sensitive to the impact of COVID, on families with young children. Also, most of my family, are school teachers. So, I was obviously hearing a lot about that. But also, even when Julie and I, she actually came to DC during the winter quarter of 2022, and that was actually the first quarter that students were back in residence at both Stanford and at Stanford in Washington, where we have a small campus. And it was really interesting talking to these well-adjusted university students and just how terribly stressful that COVID was on their own education. But anyway, what these data that was just published recently showed is that students really from all socioeconomic statuses and SVI suffered equally in terms of their loss of kind of changes in like this is just math test scores. So this was, I think, something that again showed that our efforts to safely get students and teachers back in person in the classroom, where it was doing some good. So again, this was the big school testing program, was Operation ET, or expanded testing. We used 3 contractors in 4 regions around the country to actually do this. And this was largely swab and send molecular tests, but we had turnaround, though, guaranteed within 24 hours, for all of the sites. And again, I think about 90% of the time we actually met that goal. So again, this was focused ideally on areas of high SVI, but because in some cases we didn't have as much uptake as we would have liked to, and this is honestly in a lot of the red states, that we didn't really restrict even school districts that were in higher income levels from participating in this program. We figured that was still appropriate use of federal resources to get these kids back in class. Again, the folks at CDC are just absolutely, everyone I worked with was lovely and had a wonderful sense of humor. So we actually deliberately stole Steven Spielberg's term. We never paid him any royalties, but since, I don't know if any of you remember the movie E.T., but the E.T. was, of course, one of the most kind and gentle beings that's ever existed. And I'm turning my microphone on there. Thank you. So anyway, so the other thing was in the spring of 2021, for a while, cases were at incredibly low levels in the U.S. And but still, though, I think all of us felt that we weren't out of the woods yet, and so we wanted to put together additional budgeting to really take care of what we were concerned would become a big surge later in the year. So we did put together a budget, what we call CTS, or continued testing support, focusing on areas that were really being still hit hard at that point by COVID-19. So nursing homes, there were outbreaks in just about every nursing home and assisted living facility around the country during 2021. And of course, because of the vulnerable population, high rate of hospitalization and death, in these elderly people. Again, I'll talk in more detail about testing at CBP sector stations as well as EIS sites. Again, the big part, though, is we also wanted to make sure we continued to fund the Operation ET program. So we put additional money in for school testing. Federally qualified health centers, I'm sure most of you are familiar with that term, FQHCs. So again, these are clinics located in poorer parts of the city. So, for example, Santa Clara Valley Medical Center, I think maybe 6 of their 10 or so clinics are FQHCs, federally qualified health centers. So we also wanted to get free testing out to them. We also felt that another way, to get over-the-counter tests out to poor people is distributing them free at food banks. So again, that was I think we turned out to be a successful part of this. And then also I did, as a scientist, want to be sure that we took some money and placed that in terms of, again, identifying viral variants. So we wanted to be sure that we did have some sequencing capability spread out through the United States to really help the epidemiologists understand this. So again, as I mentioned, in May of 2021, when actually I took the lead of the TDWG from my predecessor, Rear Admiral DeMarco, cases were at a very, very low level. But again, I was quite concerned based on what we were seeing in India at that point, which was this really dramatic spike of this Delta variant, as it was called then. And so again, in India, cases of Delta variant went from representing less than 5% really of cases to something like 90% within just a few weeks. So from March until May of 2021. And again, I asked my modelers at the CDC, well, are you concerned about this, or should we be concerned about this? And they all said to me, oh yeah, Dean, this is going to really hit us big. So I went to the White House. I had a daily conference call with the White House at 8 o'clock every morning. And, I presented these data to them and said, I'm really concerned. And I requested actually $3.5 billion for this CTS budget to help respond to potentially this surge with those groups that we talked about on the previous slide. And again, I like my colleagues at the White House, but just between you and me, even though the Biden White House was a lot easier to work with than the Trump White House was, they could still be somewhat difficult. So this was kind of the way the conversation went that morning on Zoom. And, and I said, hey, this Delta variant they're seeing is going to really hit us hard. And again, I showed the data that I just showed you. And, I'd like 3.5 billion to procure rapid tests for vulnerable populations. And the White House said to me in this very disparaging tone, well, Dean, that money has bad optics. And again, that's a very political term that I hadn't heard before I went to DC. So I was kind of bummed out, and I had my 4 or 5 senior people on the Zoom call with me, and I think they knew kind of how upset I was, because I left the office about 11 o'clock and I had an early lunch and probably had a beer with my lunch that day. And but when I came back, they were just such sweet people. And so you remember the movie MASH from 1970. Some of you are old enough, and it was this great movie. And there's one scene though where these cocky, surgeons say, because when they're on leave, hey, we're the pros from Dover. Well, I'm from Dover, Delaware. And so that was kind of the joke. But, and so when I came back, they'd actually printed out this picture. And Joe Miller was the head of my ICAP program. Mary Halsher was my chief finance person. And they had labeled this and said, Dean, don't forget, we're the pros from Dover. So anyway, so I hung in there, didn't quit. So they did cut the budget down from 3.5 billion to 890 million. But again, it was really what I requested, but it was just about a third or a quarter even of what I'd requested, but the distribution was fine. And then what happened though was, I think as all of you know, that in the summer, the Delta variant just absolutely exploded in the US. And again, hospitals were again overflowing, and ERs were overflowing, and so then it's like, oh my God, like, why don't we have enough diagnostic tests, to deal with this? Well, what had happened, as I mentioned, Steve Santos, my industry guy, he probably got off that call where the White House shot me down and was talking to Abbott Laboratories. They at that time were the largest manufacturer of rapid diagnostic tests. And I'm sure he told them, well, hey, that, $3 billion you were expecting to get, it's not going to be that much. So it came out later that you might have seen this in the paper, that Abbott actually shut down 2 of their 5 manufacturing plants within a couple of weeks of getting that news from my group, and laid off 1,500 employees and actually destroyed inventory. And then all of a sudden, like probably about a week or 2 later, Delta's off to the races, and now we're really in a world of hurt. But anyway, I was able to go back to the White House very quickly and get more money. So I got an additional $2 billion for the CTS budget, and then another 1.1 billion for over-the-counter tests in addition to it. So I ended up getting more money than I originally requested. But again, unfortunately, there were all these other events that happened beforehand. And we also got, additional money for supporting our ongoing operations, as well as additional procurement, including buying swabs and pipette tips and other things like that we really needed for the strategic national stockpile. So anyway, I won't obviously go through this, but these are some of the 82 people that worked with me during that time, and just really wonderful, wonderful folks. A lot of people ask, well, did you work with Dr. Fauci? Well, I didn't actually work directly with him. We both reported directly to the White House, but some of you know that I've actually known Tony Fauci since the late 1970s, when I sent a patient that had Wegener's granulomatosis, or GPA, we call it now, to him to study. At that point, his big research interest was his clinical trial of cyclophosphamide, prednisone, to treat GPA. And then, of course, during HIV, that we would often, he actually invited me to serve on various committees at NIH. So it was kind of fun being in DC. So I paid a visit to him a couple times. Actually, Dr. Parsonet took this picture. The guy on the left is Cliff Lane, who's the head of clinical research at NIH, and he's been one of Fauci's associates also since the late 1970s. Anyway, a lot of funny stories about Dr. Fauci. Of course, it was an incredibly stressful job during COVID, particularly under the Trump administration. And then the attacks, even though he's retired from NIAID, have kind of continued, sadly. But again, he's a great scientist and very good leader of NIAID, and also very, very funny. Afterward, if we got time, I'll tell you a couple of really funny Tony Fauci stories. And then that's actually Dr. Parsonet on the left there. When she was inducted into the National Academy of Medicine, and Tony's there, congratulating Julie on that. And then the guy on the left, that's Henry Masur. And he and I were the troublemakers that started the Infectious Disease Society of America Sepsis Task Force, because, again, we were concerned about the real overuse of antibiotics, more on the adult side, with the Surviving Sepsis campaign. So that's still an ongoing effort. So we got together a few times as well. And that was my CDC boss, Dr. Rochelle Walensky, who I think also provided really good leadership at a critical time to the CDC. So switching gears, I wanted to talk a little bit about the work that we did with Afghan refugees. So I think all of you remember that back in originally, President Trump had wanted to pull all of our forces out of Afghanistan by May of 2021. Actually, Biden extended that to August of 2021. And of course, that was, Trump's original decision was over the objection of General Mattis or Secretary Mattis and others. That was one reason that Mattis resigned as the Secretary of Defense back at the end of 2018. But the images that we all saw on television were just absolutely heartbreaking, of people just literally fleeing in panic, particularly as Kabul fell to Taliban forces in August of 2021. They had all these people that had, in many cases, worked with coalition forces or were women's rights advocates or school teachers. And they're literally, their lives were under death threats by the Taliban. And of course, looking back to 9/11, one of the reasons that I stayed in the military as long as I did was to basically, I believe very strongly in what we were doing in Afghanistan and Iraq in terms of fighting these terrible terrorists who did this. This is what is some very short-lived protests that happened as the Taliban were taking over. And again, these are women who previously under the Taliban in the 1980s and 1990s had not been allowed to even go to school or hold jobs. And then for a brief period of time, we were actually helping build schools and get for girls and women in Afghanistan. You had university educated women. They were even running agencies within the government. And all of a sudden, when the Taliban took over, that ended. And so that was, of course, very upsetting to me. This is what women's rights look like under an Islamic extremist group like the Taliban or Hamas or Hezbollah. This is a woman that I took care of actually in Iraq and Afghanistan, who was a young mother with an 18-month-old baby. And her husband basically, instead of just divorcing her, he poured gasoline on her, lit her on fire. And we actually were able to save her life. And eventually I got her to Boston Shriners Burn Center for care. And her child was able to come with her. And we, got her back to Iraq. And fortunately, they did arrest her husband. But this is the kind of terrible things that all of us in the U.S. military thought we were helping fight. And so these are just some pictures of different deployments. The top left is Bagram Airfield. Upper right was a combat mission probably in 2011 with Afghan National Army soldiers. Bottom left, that's President Hamid Karzai. And I was actually the doctor that was asked to go around with him when he gave speeches for several days when the first free elections in Afghanistan happened in 2004. Again, lower right is an Afghan child with severe burns that we were able to bring to the U.S. to, again, also the Shriners Burn Center. When we pulled out of Afghanistan, it was kind of a unilateral decision. And a lot of people forget that we had like 10,000 coalition partners that we also abandoned when we, pulled up stakes and left in 2021. again, these are just some scenes of Afghanistan and Iraq. Those were my medics pulling a wounded soldier off a medevac helicopter. And this is what a mass cow looks like, after a convoy's been hit by an improvised explosive device, and your emergency room is all of a sudden, overwhelmed with casualties. Again, this is scrubbing in with one of our surgeons trying to save the life of a wounded soldier. So unfortunately, we couldn't all the time. And so these are the kind of things that I still think of in the middle of the night. So, yeah, and then I was actually deployed. I was at Bagram Airfield in May 2nd, 2011, when the SEAL team left Afghanistan and went to Pakistan to kill Osama bin Laden. And I remember waking up the next morning thinking, we have won the war. And of course, unfortunately, it wasn't to be, but I remember walking out to fly a mission and I saw this rainbow. And I honestly thought that was a sign that we accomplished our mission. So we actually took our flight suits off and changed into blue jeans when we flew our C-130s back to Delaware from Afghanistan in 2011. Again, thinking the war is over, and of course, unfortunately, this is the scene, in less than 10 years later, as we pulled out. 974 refugees jammed into one C-17 aircraft, a world record which will never be broken. So I was so happy that my team and I were able to actually meet the very first plane load of Afghan refugees at Dulles International Airport, and COVID test all of before we put them in into housing on one of 8 different military bases. So again, this is actually what it looked like that very first day as the very first Afghan refugees arrived. So again, we housed the refugees at 8 different military bases. 124,000, I think, in all that arrived over about a 4-week period of time. And we were able to resettle all but about maybe 12,000, 15,000 by January of 2022. And we did see some interesting infectious diseases, not a big surprise to those of you in the room. So this is measles. The measles outbreaks that we saw were actually not in the U.S. or at the U.S. bases, because remember, they actually spent an average of 1 to 3 weeks at what we called one of the lily pads, either Al Udeid in Qatar, Emirates, I think, had a lily pad, and of course Ramstein, Germany. So the measles outbreaks, and again, this largely unvaccinated population from Afghanistan, really occurred before they got to the U.S., but definitely CDC was on board. We were able to get people really caught up quickly on their immunizations. This, of course, here of the quiz any of the pediatric residents. What's this physical sign called? Starts with a K, cup-like spots. So anyway, I'm old enough to actually, I had measles when I was a child. But again, a lot of the pediatric residents have never actually probably seen a real case. We also saw a lot of tuberculosis, and this was not a big surprise to me, because when I was last deployed to Afghanistan in 2011, the Army asked me to actually help them revise and develop screening protocols and treatment protocols for tuberculosis in the detainees that we had at the detention facility on the other side of the airfield at Bagram. So again, we did see a lot of TB. So this was something that we worked real closely, again, not just with the military, the DoD healthcare system of those 8 bases, but the local state and county health departments and their TB experts. So I think that went pretty well overall. Again, this was just a photograph from the detention facility in Parwan that I helped the Army with back in 2011. We also saw a few other diseases. This is cutaneous leishmaniasis. University of Minnesota, as well as Walter Reed, which is a real center of excellence for leishmaniasis, were very helpful in getting these patients appropriately treated. One of the things, again, also that was kind of just disappointing to me as an American was, well, again, I'm in DC, so this was in February of 2022, and at that point they closed 6 of those 8 DoD bases that I'd mentioned before, but they anticipated, still numbers of Afghans coming over by individual small plane loads or coming through land routes, and then eventually getting to the U.S. So the Department of Homeland Security made the decision to actually open this large, which had been closed because of COVID, convention facility in Leesburg, Virginia, which is just about 15 miles or so north of Dulles Airport. And I was invited to a town meeting that was being led by the mayor, where they wanted people from the community to come and let them know that this facility was being opened in the next few weeks. And honestly, I thought that this would be kind of a total feel-good meeting, and I really didn't expect to even have a speaking part, but I'd be available to answer questions from Department of Homeland Security or from individuals in the community that came to the meeting, particularly about infectious disease issues and things like that. Well, I was just so disappointed that again, remember, the right-wing misinformation is out there. And person after person from the community got up to the microphone and said, "This is terrible that you're doing this. We have a safe community. There's like a golf course nearby, in this very upper middle class school that kids go to." And person after person got up and said, "We don't want these dirty refugees here. These are terrible people. They're rapists. They're going to assault our children." And it was like, oh my God, these people were the ones that put their lives at risk when I was in Afghanistan to work with us. And you are, saying these kind of things. So again, I finally raised my hand, and the mayor asked me to come up to the microphone. And I was like so angry and upset. I, had my HHS identification badge on, and I took it off from around my neck and I slammed it down on the lectern. And I told him that, this was in the Washington Post. I didn't know at the time he was a Washington Post reporter there, but I told him, I said that how upset I was that they were not welcoming these refugees, because these are good people that are took care of us. They put their lives and their families' lives at risk in Afghanistan. And I said, we need to do the right thing. And actually, there were a lot of people in the room that actually stood up and clapped when I said that. So, but it was disappointing to me. And again, I don't want to get too much into politics, but this, anti-Islamic fervor really started, I think, under Trump, even before he was elected president. And he's again talking about a Muslim ban. Apparently, I just saw that in the New York Times just recently. So this is again what happened just a few weeks ago after the war in Gaza started. This little Palestinian boy, 6-year-old, beautiful little boy in Chicago, he was actually stabbed to death by his landlord. So again, I just hope that our country grows. This is a translator. His name is, he goes by Q. His name is Kays, Q-A-I-S, I guess is how you spell it. And this was when he was working as a translator with U.S. Army unit in probably 2010. He did that for like 3 years, and he was actually blown up by an IED. Although I didn't take care of him, he was actually in our hospital at Bagram Airfield in 2011 when I was deployed there as the flight surgeon. And then, lo and behold, I meet him again. He's one of the security guards at Stanford in Washington. So that's one reason I love going back to Washington. I'll stay there just mainly so I can say hi to Q. This is a movie I haven't seen yet, but apparently it's really good. It talks about, again, the relationship between American soldiers and their translators and liaisons. So again, I'm not trying to proselytize, but this experience that at this meeting in Leesburg, it so upset me. Actually, I went back to the Bible and found out, well, like, what does the Bible say about refugees and immigrants? And this is from Matthew, and you can just read it yourself there, but I think it's pretty clear about how we as human beings are expected to treat refugees and immigrants. So with that, in the last few minutes, I'm going to talk a little bit about the Southwest border. The numbers of immigrants through the Southwest border kind of wax and wane over the years, but these unaccompanied children, I found particularly heartbreaking. And under the Trump administration, there was actually almost deliberate cruelty to dissuade people from coming across the border. Fortunately, that changed overnight when the Biden administration came in. But again, most of these children were actually entrusted to what they call coyotes, who often, extorted huge amounts of money from their family to bring them across the money, and often, of course, abused these children as well. This is a terrible thing. And again, just your heart goes out. But Paul Wise is here, and he can, he's of course now the DHS consultant, has been so for several years now for the unaccompanied children. Just a little bit about background: the majority come from Guatemala and Honduras, where there's just terrible poverty and violence. This is again how the right wing looks at immigrants and refugees. This is Ann Coulter, who's a Fox News commentator. This is Tucker Carlson, formerly of Fox News. I guess he's not there anymore. These are the Unite the Right rally in Charlottesville, Virginia, 2017, where they're not only chanting against immigrants and refugees, but also are chanting, Jews shall not replace us. I mean, this is just horrible. This is what a big proportion of our country supports. Again, this is more right-wingers. This is what the previous First Lady, Melania Trump, when she visited the southwest border in, I think, 2017 rather, and her jacket, I can't read it, it says, "I really don't care, do you?" So this is what was coming from the very top of the federal government in terms of the way we approached refugees at the southwest border. This is Pat Robertson. Was a minister, died just recently. And again, he was a big anti-immigrant, white nationalist preacher. So I remember watching this movie when I was a little kid in the 1940s or 50s even. Americans believed that you should be kind to people who are different than you, be kind to refugees. And again, this was a beautiful song from that movie. So it always kind of perplexed me, like why the people who call themselves Christian, worship Donald Trump. And of course, not all of us do. But this is actually kind of where I think people, the traditional Protestants and Roman Catholics believe about things, that, all people are welcome. Not only Black Lives Matter, women's rights are human rights, love is love, science is real, no human is illegal. These actually used to be Republican core values, believe it or not. And so anyway, just going back to Bloody Sunday of March 1965, when John Lewis led protesters across the Edmund Pettus Bridge in Alabama, and of course was beaten bloody in this. And interestingly, probably every single one of those white state cops is a Democrat, which is kind of hard to believe now. So this is number 37, is me playing varsity football in high school in 1969. And it's another view on the sideline. I just show this because I got hit on the head so many times playing football. I would have scored 200 more points on my SATs if I hadn't played football. But the thing where it's showing that is just that, I'm like Forrest Gump. I'm not a smart man, but I know what love is. And so this is the short version of how we should treat refugees and immigrants. Again, these are some of the unaccompanied children. We set up testing at 5 of the 9 CBP sector stations where 90% of the children were coming through. Our goal was to basically get them out of the CBP sector stations within 24 hours, which we were able to do. But in order to safely transport them, again, during the height of COVID, we put them on either a hot bus or a cold bus, depending on their COVID status. It worked really, really well overall. And again, I had a great working relationship with Homeland Security and CBP. We had a weekly conference call. My lead person that ran the testing, her name was Dr. Ellen Kirsch, and again, did a great job leading it. Most of the time we had these conference calls on Zoom, and we had our cameras off. And, I would often be doing email, letting Ellen run the meeting. And then I remember though, this one time there was a new CBP representative on the call. He was being really rude to Ellen. And so I finally turned my camera on, and I was still on active duty. So I had my uniform on, and I said to him, "Hey, officer, listen up. Let me tell you how we did this downrange." And all of a sudden, he sees this full-bird colonel, and he says, "Yes, Colonel, Roger that, sir." So anyway, last thing I'm going to close with are that the Biden administration opened 3 emergency intake shelters at Fort Bliss, Pecos, and Carrizo Springs. And they did just a wonderful job. So again, the kids would be transported there, again, ideally within 24 hours. They had underwent immediate health screening. They were issued really nice clothes and underwent psychological screening and actually started school within 24 hours. So again, not perfect, but it was just really, really wonderful compared to what existed before. So anyway, I'm going to quit there. This was actually, they gave me a nice award just last year back in DC. So that was really nice. And I just want to close for the residents who might be on Zoom. So my recommendations for leadership: lead from the front. Remember the Air Force core values: integrity, service, excellence. And then this is very Buddhist, but show up, pay attention, always tell the truth, and don't be attached to outcome. And then this is from me: remember, love is the most powerful force in the universe. Be kind. And then as a pilot, I always say, take off and land on the center line of the runway. So that's my words of wisdom. And then again, thank you so much for inviting me. Okay.
All right. Thank you very much. So that was a tour de force in every sense of the word, and it touched on so many of the things that this department is really passionate around, and advocacy and health equity. I just want to remind the folks on Zoom that we do have a mechanism to answer your questions. If you want to type anything in. Any questions from the audience? We'll make sure we use the microphone so people can hear. So I have a question just related to the timing. So we are right now in the throes of hiring the Children's Hospital first Chief Health Equity Officer. And both hospitals are hiring Chief Health Equity Officers, and then we're in the middle of the interviews and we're in the middle of their town halls. And I was curious, if you were to meet any of the candidates, what would your advice be when you think about taking a position like that?
Well, I think again, the most important thing is just be creative and be passionate about what you're doing. I think we're so lucky, here in Silicon Valley. We just have so much resources and so much wealth that we shouldn't be shy about sharing that. So I think that's wonderful. I wasn't aware that you actually are going to be health equity officers in both the adult and the children's hospital, but I think that's great. And again, a creative person with a lot of energy, I think, can do really a lot of good. So
yeah, I've been telling the candidates that there's this army of faculty and staff that are so excited to line up behind somebody who's going to drive this work. But I was thinking, you've navigated a lot of interesting waters, and I bet you would have a lot of good advice for someone like that. Lisa Chamberlain, question.
Oh, thank you so much, Dean Winslow. That was amazing. Really appreciate your leadership. You didn't have a chance to cover it because you covered so many things, but in regards to scrubs and your work around gun violence, any opportunities for us coming up in the next year? Where do you see that work going at federal and state levels?
Well, so first of all, Lisa, thank you so much for your leadership and support around this. And I think probably all of you know that to me, it's just terrible that guns are now the leading cause of death in children. And for the wealthiest country in the world, that's not at war, to have that statistic is just terrible. I think, that we actually do have an opportunity now, to make some more strides. Again, COVID is enough behind us that I think that, again, we can start having, more in-person events. I think advocating to legislatures. Believe it or not, that shooting that happened in Tennessee a few months ago, I think really even Republicans are now starting to come out, behind at least reasonable things like universal background checks, registration. A lot of people think all guns are registered; they're not. And also perhaps even one of the things that I feel strongly about is having basically to go to a doctor every couple of years if you're going to own a gun, to be signed off that you've got eyesight, cognition, and you're not crazy, and all that, and as well as mandatory training. Go ahead, Dr. Parsonet.
I just wanted to respond to that because I work with Dean on SAFE. And I do want to just mention that we do have 2 educational modules that one of which comes out of Mass General, which is an avatar-based educational module where people can learn how to talk to patients about gun violence. And the other one is an online module. And we're in the process, we've submitted a grant. We're hoping to get funded to test those modules. And we're hoping to do that in the clerkships at Stanford. And so I just wanted to mention that because we'd love to do it in pediatrics and to start testing some of the educational modules. And I also just want to mention there was a paper just this week that only 3% of pediatric visits, does anybody ever ask about guns in the home? And so I think we could do a lot better about that.
Great. Thanks so much. And maybe we'll have you distribute the.
Yeah, no, I think that's
what
great. We would
modules
love
on
to
the
do that.
website.
I think for many of us, guns felt like the leading issue maybe 5 years ago, and then so much has happened, and there's so many, burning issues. So, all right, well, with that, our time is up. I just want to thank you for everything you do, for all your service, and for coming and speaking with us today. So thank you.
Thanks, Dr. Henry.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.